There's going to be 30 minutes for question and answer. So we will answer your questions at that point. So if you have a Dolphin Neurostim, please go ahead and get it out for me. And we will start going over everything. So grab your Dolphin Neurostim if you have one, and we're going to go tonight over how to use a Dolphin Neurostim, how to find points with it, how to do treatments, how to treat scars, and how to do also vagus nerve stimulation. So we got a lot of ground to cover. All right. So starting at the front of the Dolphin Neurostim, let's see, that's blue, so I need to get it so you guys can see it. Starting at the tip here, we have a biocompatible alloy tip. It is worth noting that there is a spring in this tip. And when you clean this, you don't want to get liquid down in there because it can cause corrosion. So just clean it with an alcohol wipe, and that will cover everything that you need. There is a conductive medium in there that can be rinsed away, and we don't want to get rid of that. Moving up from there, you will see a black button right here. This black button is the button that you push to initiate a treatment. You'll notice that it doesn't do anything when the unit is off. I can push it as much as I want to, but when the unit is on, as long as you're holding this down, you're initiating and doing a treatment. When you release this button, the treatment stops. So it doesn't start a treatment and then finish on its own. And then up from there is a roller switch. So this roller switch does three things. The first of which, it turns the unit on and off. The second of which is it initiates the battery check light on here. And the third thing is that it adjusts the intensity of the stimulation when you guys are doing treatments. So I'm going to turn it on and flip it over. Now, when I flip it over, you should see a green light right here. And if you don't see a green light right here, that indicates that the unit needs a battery change. So seeing as how there is not a green light right there, we are going to go ahead and change the battery and go over that part. So you're going to need your Dolphin Neurostim. You're going to need one of three batteries. So the three batteries we recommend for the Dolphin Neurostim are Energizer batteries, Duracell batteries, and Panasonic batteries. If you venture off from that, you are on your own. So here are the potential problems you can run into. Oddly enough, not all 9-volt batteries are the same. So if you have a battery that's too short, when you put it in the battery compartment on the Dolphin Neurostim, it's going to rattle around a lot, and you're going to get intermittent contacts, and you're not going to get a very good treatment. If you get a battery that's too long, there's actually a plastic post in here that you can push, and it will actually break. So if you just stick with the batteries we tell you to use, then you should be fine. The other thing is, if you start using cheap dollar store batteries instead of these, they have a habit of dumping all their voltage at once. You do kind of get what you pay for in batteries. And when they do that, they can actually burn out the circuit board faster on the device than if you use regular batteries. So I use these things. I start at 8 o'clock in the morning. I do 10 hours worth of therapy during the day. And that's probably 3 days a week. And then I do probably another half day and another 3/4 of a day during the week. And I get about a month out of my batteries. So any of these batteries should last you quite a while. Now, if you're doing vagus nerve stimulation for hours on end, then obviously it's not going to last quite as long. But if you're doing just regular treatments, so in every hour treatment I do, I probably do about 20 minutes of Dolphin Neurostim, and then maybe some vagus nerve stimulation along with that. So you'll get a lot of life out of a battery. All right. So the thing that the office wants me to tell you guys is that when you go to change the battery, if you look at either end of the Dolphin Neurostim, you will see a couple of screws right here, and right here. Do not remove those screws. We have a lot of people who try to take those screws out to change the battery for reasons I'm not really sure of. But when you do that, the entire unit comes apart, pieces fall everywhere, and two things happen. One, you void your warranty, and two, you have to send it back to us for us to put it back together for you. So don't take it apart. All you need to do is, there's a little slit right here that's your battery compartment light, and you can actually take a really any kind of coin. So I'm just going to take a quarter here and just pop this right off, and it comes right open. You'll see I've got a Duracell battery in there. It is a tight fit. You're going to give it a little pop with your hand, and then you can pull it right out. So set that aside, take your new battery, and there is a little chart in here that tells you how it is installed. Slide it in. Like I said, it's a tight fit. When you go to put this cover back on, it's going to be tight. and it's going to make a pop, and it feels like it's going to break. I promise you it won't break. It just needs to be tight in there. So I don't have any intermittent contacts on here or anything. It's a nice tight battery. All right, so now I'm going to turn the Dolphin Neurostim on with the switch here, roll it over, and I've got a nice green light, which tells me the battery's good. So perfect. So now when I'm doing a treatment, so now that it's on, if I hold this button down, then it initiates a treatment. And you can actually see that the light's blinking on there a little bit. So that tells me that something's going on. And while I'm doing the treatment, I can actually roll this switch up and down to control the intensity of the stimulation, because sometimes you're going to hit some treatment points that are much more tender than others. You need to roll it back a little bit. Up from there is a little tiny button, and this is a continuous treatment mode, and it runs for it's time. So it runs for between 11 and about 13 minutes. But when you push it, two things happen. Number one, it puts the Dolphin Neurostim into a silent mode, which is nice. And number two, you don't have to hold the button down to do a treatment. So that's going to come in handy when you're doing things like vagus nerve stimulation. Normally, when you're doing treatments, you're using this device to find points. So you need to be able to hear the tone and watch the light. But when you're doing vagus nerve stimulation, it's best to do this so you don't have to hold the button down the entire time. This unit does kind of measure the number of electrons that go through it, and after a certain count, it cuts off. So if your battery is a little bit stronger, it's going to be a faster treatment, closer to like 11 or 12 minutes. If your battery is a bit weaker, you're going to have a slightly longer time, about 12 or 14 minutes. But at the end of that treatment, what will happen is that the device will go back to what we call search mode, and you'll get a steady light like this, and you'll hear a constant tone. So I know I'm moving kind of fast here, and just so you guys know, tomorrow you're going to get a link, and you can actually come back and watch this video as much as you want to. So again, if you have questions, just type them in the chat box, and we'll address them in a little while. Is it better to let the battery run out completely before charging it? Well, you don't really charge it. Oh, before changing it. No. Just go ahead, and if you see this light, if you turn this device on, this light isn't green, go ahead and change the battery. You can get a couple of treatments out of it, but you don't want it to stop in the middle of a treatment because that's a pain in the neck. Okay. And that was, who was that? Yuki. All right. Next thing, if you look on the back of the Dolphin Neurostim, there is a little metal pad right here. This is really important in your treatments. When you are doing a treatment, you either have to have your finger on this, your thumb on this metal plate, or you have to have a special electrode on there that looks like this, that obviously is cut to fit here. And it will be attached to a wire, which then goes to your patient that you're treating, because you have to be able to maintain the circuit. So there have to be 2 points of contact to maintain the circuit. So that's going to be the tip of the unit, and you touching your patient, and skin to skin, so you can't just touch on their clothes, and then you touching this little metal plate so the electrons can cycle through your hand back into the device. And it doesn't really matter which hand you use. So I could touch on my patient with this hand, or I could treat a point and then touch with the other hand, and that would be fine. Just you need skin to skin contact. So touching on clothing is no good. All right. So up from there, you have let me put my glasses on so I can see here. Up from there, you have two little slider switches here, and you can see the bottom one says wet, normal, and dry. So this is a feature that allows you to change the sensitivity of the ohm meter. This device finds myofascial trigger points, Chinese acupuncture points, and motor points in muscles. So all of those are electrically similar. All of them have a greatly increased ability to conduct electricity. So if you were to take an electrician's ohm meter and run it around your body and actually watch the dial, you would see that there were places where the needle would spike up that are much more conductive than others. Somewhere back in the 1950s, they figured out that all those points were acupuncture points. So this has an ohm meter built into it. Clearly, there's not a dial on here anywhere that you can watch, a meter of any kind you can watch. So it's tied into a tone on the device, so that when the changes in pitch occur and when the light goes out on here, it's going to let you know you're on a treatment point. So we're going to go over that again. We're going to circle back around to this in a minute. We have a couple more features to look over here. So next is the polarity. Oh, so let me talk about this for a second. On the sensitivity of the ohm meter. So I live down in Georgia in the States, and down here, it's pretty humid most of the time. So I find that if I keep this on the normal setting, it's pretty good. In the summertime, it gets quite hot down here and very humid. So I have patients who come in who are a little bit sweaty sometimes, and sweat is salt water, so that's conductive to electricity. So it makes everything more conductive. So then I have to switch this over to the wet setting because otherwise I will get false positives every time I try and find an acupuncture point, a motor point, or a trigger point. And then if I live somewhere that's cold and dry, then I'm going to put it over on the dry setting. If you happen to work in like a nursing home or something like that, where the air conditioner is always on and it's always keeping the humidity down, and you have elderly patients who don't drink enough water, you are probably going to keep this on the dry setting. It's the most sensitive setting. So it's the easiest setting to actually find acupuncture points if somebody's skin is dry. And when you're practicing with this, what I tell people is if you play with this for about 2 days, just mess with it at home in the evenings and, mess around with your family and stuff like that. It takes a couple of days to really learn how to zero in on acupuncture points, but it's not a hard thing to do. My kids have been using these since they were, I don't know, like 5 or 6. And even then, they could find acupuncture points pretty handily. So it's not a difficult thing to do if you just kind of take your time with it. Then above that is a little switch here that says polarity, and you'll notice there's a minus, a plus, and a plus minus symbol. So the minus is a negative polarity. So in acupuncture, that's sedation, that's bringing things down. So in the world of acupuncture, you're either trying to bring energy up or bring energy down to balance energy out. In Western society, in Western medicine, we're trying to bring conditions down like muscles that are too tight, or we're trying to bring tone back into an area with something like Bell's palsy. So if I had a muscle that was too tight, I would put this on the negative setting. If I had a muscle that was kind of flaccid like Bell's palsy, I would put this on a positive setting to bring energy back into the area. And there's another setting on here that's a plus minus setting. So that is the biphasic setting on here. And the biphasic setting will allow you to flip electrons back and forth through an area. It pushes and then it pulls. And that's going to come in handy when we get to treating scars. You're not going to use it for much else. It's a good homeostatic channel if you don't know what to do. But most of the time, when you look in your treatment books, whether you're looking at the vagus nerve stimulation book or the little natural health book that comes with the device, there are a lot of protocols in here. And each of them will have a plus or a minus next to all the points. So every protocol is going to tell you what settings to use on this. So you don't really have to worry about that. If you do have any questions about what polarity you should use, just think about it in terms of what you want to get out of it. So let's say you have something like an asthma attack and you're treating lung 11 on the thumb, which actually works quite well. I've never seen it not stop an asthma attack, but that's something you want to bring down. You want less asthma attacks, so you would keep it on the negative polarity. Something like a migraine headache, you want less of that, so you want to bring it down. Something like constipation, you want less of that. But interestingly, diarrhea, you want less of that too. So both of those are a negative polarity. You think they might be opposite of each other, but they're not. Things you might want to bring up would be things like I said, we've got somebody with Bell's palsy. But from an energy standpoint, if you've got somebody who has recently delivered a baby and their kidney chi is deficient, you might tonify, put this on plus, tonify kidney 3, which is a source point for kidney energy, to bring their energy up. And the kidney energy is also representative of your adrenals. So you have somebody who is adrenally depleted, you might treat points to bring that up. You might use points to bring things up for alertness. Like if you're really tired, you need to get pepped up a little bit. There are points for that as well. Or if you're involved in athletics and trying to prepare for an event that's coming up like in the next few minutes, you might use that to tone your muscles a little bit. All right, that's all the features on the Dolphin Neurostim. So now we're going to get into how to actually find some of the treatment points. And I'm going to use this natural health book here, and I'm going to turn to page, let's find a couple points that will be easy for you guys. I am on page, let's see here, 58 right here. So you will see that there is a neck pain protocol on page 58. And we have this point right here on the side of the hand called small intestine 3. So we're going to find that point. And to find small intestine 3, I'm going to grab a pen here and draw it out for you, assuming I've grabbed one that works. So if you look at the palm of your hand, there's a crease that goes from between your index finger and your middle finger, and it goes all the way out like this to the edge of your hand. So that if you make a fist, there's a little lip of skin right here, and the acupuncture point, the treatment point, is right there in the end of that crease. So you're going to actually place, so let's turn the Dolphin Neurostim on. We're going to check and make sure we've got a green light. Battery's good. So now we're going to bring this along the crease in my hand, and I'm going to turn this so you guys can see what happens here. Let's see if I can get the angle right. I'm going to bring that along. And when I get on the point, you can see that the light goes out and the pitch goes way up. So those are the two things that indicate that you're on a treatment point. You're going to hear a really high pitch, and you're also going to see the light go out. Now, you need to use this gently, and you need to use it slowly and carefully. If you poke around a lot like this, you'll notice that these aren't all acupuncture points, but I'm pushing so hard that A, it's uncomfortable, and B, I'm compressing the skin. And when you compress the skin like that, it becomes more conductive to electricity. So you can actually get a false positive if you push too hard with these, but you'll pretty easily figure out what's comfortable and what's not. So you just want to stay in the comfortable range and move slowly. So we're going to pull this all the way out. Again, the light goes out. And so I'm going to make sure I'm touching that metal plate. I'm going to turn the unit over so you can see. And while I'm touching this metal plate, I'm going to push this button. And I'm going to count out about 30 beeps. So any of the protocols you see in our books, if you count out about 30, neck is page 62 for you. Oh, well, you must have a different version of that. Sorry about that. We have some older versions of this and some newer versions floating around. But anyway, if you'll just hold on there. So small intestine 3 is a great point for the entire spine. It's really good for spasmodic torticollis. And when you're treating this point, you're going to have your patient kind of turn their head to the right and breathe out. And just go back and forth. So to the right, back to the left. And with each time they do that, you want them to breathe in and then breathe out as they're turning their head. And what you'll see is the range of motion will gradually increase. It's also a good point for even low back stuff, since it does treat the spine, but it works particularly well for spasmodic torticollis in babies. And I've seen it also work on adults who have, wry neck. All right, so let's grab another point out of this neck protocol here, and we're going to look right here at large intestine 4 right here. It says LI4, and you'll see that's marked with a negative polarity. So large intestine 4 in acupuncture is known as the great eliminator. It's also known as Hoku, and it is found by finding your thumb and your index finger and finding this little area right here, and there's a little bit of skin right here. Now, if you stay in this area, you're not going to be on the treatment point. You actually have to move up into the fleshy part right in here. So what I tell people is to hold their hand like this and squeeze it. And you'll see when I squeeze my thumb and index finger together, it makes a little mountain. So right on the top of that mountain is going to be my acupuncture point. So I'm going to mark that with a little X here so you can see it. And we're going to find it. So I'm going to turn the Dolphin Neurostim on. I'm going to check and make sure I got a green light. It tells me the battery's good. I don't need to change it. I'm going to pull the Dolphin Neurostim along here carefully. And you'll see when I get on the point, the light goes out. Now, if I move off the point, you see the light turns green and the pitch goes down a little bit. And when I go on the point, you can see the light goes off again and the pitch goes way up. So you're always looking for a much higher pitch, and you're always looking for the light to go out. Now, of the two of those, the pitch is the most important. There are times when you won't have exactly the right setting down here. Maybe the person's skin is drier and you have it set on the wet setting or something like that. And the light won't go out, but you'll still hear the change in the pitch, and that's going to be your indicator. So for me, I've been using this system for close to 25 years. I can tell you that I rarely ever watch the light anymore. I just listen to the pitch. The only times that I will ever look at the light on this is when I first turn it on. So there are 2 times really to look at the light. When you turn it on, and then also when you're finding points, you might want to watch it because it is really satisfying to see the light go off. Other than that, don't really watch the light, because when you start initiating treatments, sometimes the light will blink, sometimes the light won't blink, and that comes. People have all kind of odd questions about that, and I can tell you that the times you want to look at the light are when you turn it on and when you're looking for points. And when you're looking for points, if you have to choose between watching the light or listening to the tone, excuse me, the tone is the much more important of the two, because some acupuncture points are actually pretty big. And within the area of that acupuncture point, there's going to be an area that has the highest pitch. Now, the highest pitch indicates the area of highest conductivity. So your skin is not a very good conductor of electricity. It's actually meant to be an electrical barrier. Everything that happens in your body happens because of electricity and chemistry. Like, those are the 2 ways that we can actually affect the body. So, chemistry would be through medications and stuff like that, and electricity would be through, using electricity. So if you're trying to make changes to the body, you have to be able to get this current in. Now, this is microcurrent. So what that means is this is in millionths of amps. Like, if you look at your standard, like even like a TENS unit that you would get off the store, like from your physical therapy clinic, or like from, I don't know, any medical supply, that's in the milliamp range. So that's thousands of times more powerful than this. This is a tiny amount of electrical current. So if you don't get it through the skin, it's not going to have any effect. So whether you believe in acupuncture points and chi, it doesn't really matter. What matters is that you can locate those points, because those are the points that are going to allow you to get the current through the skin to the tissue beneath there. So you always want to shoot for those points. If you're just going to kind of stick in this around willy-nilly, sometimes it works. I have patients who do that, who aren't particularly bright, and they just kind of poking around wherever it hurts. They have these for home use, and they get okay outcomes. But once I teach them how to locate the points properly, or teach a family member how to do that, their outcomes are much, much better. So it's worth taking a little bit of time to learn how to properly locate your points. Okay, so that's how you find your acupuncture points. Hoku here that we just found, the Great Eliminator. It's a point that's great for any kind of anterior neck or face problems. That could be a jaw problem. It could be a tension headache. Don't use it on migraines. It can actually trigger a rebound migraine. Any kind of dental problems like swollen gums or an infected tooth. You don't want to treat this one on pregnant women. It's one of the points that could be used to induce labor. It is the Great Eliminator, so it will push things out of your body. It is widely used for most pains around the body, so it's a good acupuncture point to know generally. But other than that, there are just tons of points in here that you can learn. The nice thing is that it's all listed out for you. So any problem you have, you can look it up in here. If you have something that is not in your book, you guys are going to get a link tomorrow, which will allow you to connect to our Facebook page. And there's a forum on there. So if you get on our Facebook forum, you can type in questions there, so that other people who are doing this, or therapists like myself, get on there. We also answer questions for you. So we're not going to give you long, complex protocols for things like concussions and stuff like that. But if it's a small thing, like you need to know how to treat a broken nose, we'll run through a few points for you, because it may not be in the book that you have. All right, that's how to find points. So the next thing we need to go over is how to do vagus nerve stimulation. So what is the vagus nerve and how do you treat it? Well, the vagus nerve is the longest nerve in the body. It is known as the wandering nerve. It starts kind of on either side. The closest you're going to get to it is around the ears, and it comes down and comes together in the chest, and it runs all the way down into the abdomen. And it is considered to be the information superhighway between the brain and the gut. More information goes from the gut to the brain than goes from the brain to the gut. So it has a very strong influence over your autonomic nervous system. Stimulating the vagus nerve can affect your fight or flight response and your rest and digest functions. So that's the sympathetic nervous system and the parasympathetic nervous system. Most people end up spending too much time on the sympathetic side. So if you look at the yin and yang symbol, we'll see right here on the Dolphin Neurostim, That yin and yang symbol is actually representative of the sympathetic and parasympathetic nervous system. So the white side of it is the yang side. That's the male side. That's the warrior side. So that's your sympathetic nervous system. That's your fight. That's your fight side of your nervous system. The yin side is the darker side of it. That's the female side. And that's the one that does what mothers do, which is heal you and nurture you. So you should spend about 70% of your day on the parasympathetic side of your nervous system. But what ends up happening in today's society is things move at such a fast pace. Nobody rests. Everybody spends too much time on the computer, driving and doing all these things. So we end up spending way too much time on this on the sympathetic nervous system side and not enough time on the parasympathetic side. And what that yields is terrible sleep patterns, lack of recovery, reduced immune system, more sensitivity to allergies, more sensitivity to autoimmune disorders because your sympathetic nervous system drives those things. So if you have some kind of autoimmune issue going on, the more time you spend on the parasympathetic side with less stressors in your system, the better your system is going to react. Same thing goes if you're sick. If you're spending a lot of time on the fight or flight side when you're sick, your body really can't fight against it. So you need to be able to heal from these kinds of things. Okay, so how do we go about changing the vagus nerve, changing how you go between the sympathetic and parasympathetic nervous system? Well, there's some attachments you can put on the Dolphin Neurostim. This is one of the older models. You should have a blue tip model. If you don't have a blue tip model, you can actually do a trade-in right now. So we're doing our Black Friday sales right now, and it's a good time to trade in old units for new units. I'll give you guys a code later that'll let you do some of that stuff. But for right now, let's focus on this. Okay. So to do vagus nerve stimulation, you are going to need the following things. You are going to need a black cable that looks like this. It has a cup at one end and a male little probe at the other end. And if you look inside that cup, you'll see it's kind of flashy and metal. So this needs to attach over the end of the Dolphin Neurostim. The metal here needs to touch the metal in that cup. So we're going to push that down so it's a snug fit. Then you're going to need some ear clips. Now, you should have a bag of ear clips, and of the ear clips in there, if you have an older set, you're probably not going to have this. But if you have in your bag, there will be one of three variations or all three. There will be some clips that look like this that have metal in them, on them. And these are fine if you're going to put them on things like your earlobe. If you have sensitive skin, I don't recommend using these because these can be a little irritating. Then there are some ones that have conductive rubber on them like this, conductive silicone. It actually has carbon in it. You do need to moisten these, so I recommend using something like hand sanitizer or alcohol. So you just put a little bit on there to moisten it so that it's conductive, and you can put it wherever you need, usually on the earlobe. But what you really want for vagus nerve stimulation are these, and these are our dome ear clips. So you can see that there's a pretty big difference between the two of these. And if you don't have them, I do recommend ordering a set while the Black Friday sale is going on, or picking up some extras. So again, you want to use something that's a little bit conductive. You could use water, but I like alcohol. Alcohol gel seems to work well for me. This allows you to get to the place in the ear that has some of the highest number of nerve endings for the vagus nerve. So there are 3 places in the ear that you can clip this for vagus nerve stimulation. So we have our little model ear here. According to a recent MRI study, the highest concentration of vagus nerve endings is actually on the inside of the tragus. So this little flappy thing right here that covers your ear hole, like that's called the tragus. So on the inside of that is the highest concentration. And if you try and put one of these ear clips on there, it has a tendency to just kind of slide off. The flat ones do a slightly better job, but it's hard to get them to stay there. And generally, I don't shoot for that as a location. The second best area you can shoot for in terms of concentration of nerve endings for the vagus nerve is in the upper concha of the ear. So You got the tragus, the ear, the flappy thing here. And if you follow this around, there's a little hollow up in here. So you can actually put your finger up in there. You just kind of run your finger up in there. And that's the upper concha of the ear. So these actually are designed to get to that area. So you want to put the dome part of this ear electrode, this ear clip, right in there so it contacts the skin. So this is what it's going to look like. So this is going to be connected to your black cord. So now I have a connection from the Dolphin Neurostim to the ear. Okay. The next thing you want is you've got a package of electrodes like this, and they are designed to fit on here. I do recommend that before you put any of these on here, you clean this really well. You're going to have oil from your skin on there from using it, and that's going to affect the gel, the hydrogel on the electrode itself. And what that's going to do is affect its ability to stick. So you only have a limited number of these in your pack, but you're never going to put these on somebody's skin. So all you have to do is take one of those and make sure you have good adhesion on there. You're just going to stick it right on here. And you can use these over and over again. So one of these on my own personal units at home that I use for vagus nerve stimulation will last me for months. And that saves you from having to buy new ones. If you do want extras of these, go ahead and order them now. They're running, like I said, they're doing Black Friday specials right now, and you can pick up some of them just to have some extras. So you also are going to have a white cable, depending on how old your device is or your kit is. You're going to have a white cable that has 2 male connectors on it like this, or you may have one that has a connector on it that looks more like this. It's going to have a male connector at one end, and then it's going to have what looks like a female connector at the other end. But if you look in there, it's not really a female connector. It's just a shrouded male connector. So both of these cables are the same, but some hospitals require us to have the shroud on here. So this is what you're going to get if you purchase it recently. It doesn't really matter which end you use. It may in a hospital, but for home use, it doesn't matter a whole lot. But for the sake of safety, we're going to take the pokey end of this, and we're going to put it into this white electrode that's on the Dolphin Neurostim. So the only thing we have left to do is to take one of our rectangular electrodes that look like this and connect it up. Now, again, I do recommend that before you put this on yourself, that you clean the area thoroughly with alcohol, because there's going to be oil in your skin. And if you're just using this on yourself, you can use this same electrode over and over and over again. I get about a month out of one of these using it at home, but I'm always careful to clean my skin. And when I'm done, I put it back on this little plastic sheet so that it maintains the moisture in the hydrogel. So we've got it all set up now. So what do? Well, we put this clip on the upper concha of the ear, and this rectangular electrode, there are 2 places we can put it. Now, if you read in the vagus nerve stimulation book that comes with your device, it will tell you that, and there's also a quick setup guide that looks like this. So you can look at that. So if you have any questions or can't remember it, just pull this out and it'll show you the different places you can set up the ear clip, and it will also show you where you can set up the rectangular electrode. So you can put this on the wrist right here. I do this quite a bit with my patients, and you don't have to touch anywhere that's personal for people, and it covers 3 acupuncture points right here, which are considered to be the golden triangle in acupuncture. So they're very parasympathetic, so they bring things way down. Or you can put it about 4 fingers below the belly button. So there is an acupuncture point about 4 fingers below the belly button. So you would count down from your belly button about 4. Well, obviously, my fingers are too big for this, but you would go about this far down below your belly button and put the electrode right there. And once you have that in place, so I'm going to go ahead and hook myself up here. So I've got this on the upper concha of the ear, and I'm going to put this on my wrist. So I've got I'm going to put this on my left wrist. So if you look at your book, it's going to tell you most of the time left ear, left wrist. This is the best side of your body for bringing things down. You can either put the electrode like this, or you can put it across. It's sort of up to you. But you want to go just a little bit below the palm of your hand if you're going to do it across, like this. And then once you've got that in place, you want to look at the back of the unit. Now, the sensitivity doesn't matter because we're not finding acupuncture points, but the polarity does matter. So we want to bring things down. So we're going to choose a negative polarity. So once we've got all that in place, we're going to turn the Dolphin Neurostim on. And what should happen is you should hear a really high pitch, and you can hear that I have really high pitch, and the light has gone out, indicating that I've completed the circuit. So if I were looking for acupuncture points, that would be correct. But it's also, this is telling me I've got a completed circuit. So at this point, I know that I'm connected up properly. So now I'm going to go and push this little tiny button right here. And then the unit's going to go into a silent mode. Now, sometimes that light will blink like this, but if I turn it way down, sometimes it is not going to blink depending on what setting I have it on. So if you play with it a little bit, you may notice that the light changes. It may cycle differently. Don't pay any attention to it. Again, the only times you're going to look at the light are when you turn the unit on to make sure you've got a good battery and when you're actually finding acupuncture points. Other than that, don't worry about it. So now that the Dolphin Neurostim is on, I can do whatever. I can go read a book. I can wash dishes. I can lay in bed. The original, not the original units, but the model before this that has the white tip, these do continuous treatment for forever. And what ends up happening is people put the Dolphin Neurostim on at nighttime when they're in bed, and they'll fall asleep, and then they do vagus nerve stimulation for like 6 hours before the battery dies, and that's no good. So we actually put a timed treatment cycle on here, which makes it a lot nicer too, and it doesn't make any noise. So you can, like, if you're using this, a kid who's autistic, my stepdaughter was autistic or is autistic, and I use this kind of stuff on her pretty regularly, and it worked quite well before she became an adult and kind of went out on her own. So it was a nice thing to bring her anxiety down. So when would you use vagus nerve stimulation? You would use it to recover from athletic events. So if you've just finished an intense workout, as soon as you can, put the Dolphin Neurostim on for about 20 minutes or so. You would use it when you're sick. When I had COVID, this is one of the things I used to bring my oxygen saturation up. My oxygen saturation was pretty abysmal. When I had COVID, it was around 91 or so. So it was really not great. But one day it dropped down to about 80. And I really, really felt miserable. I felt like I was going to have to go to the hospital. So I put the vagus nerve stimulation on, and I had been using it previously, but then I kind of thought I was out of the woods. I thought I was getting over COVID, and it turns out I wasn't. So when I didn't use the Dolphin Neurostim for vagus nerve stimulation, the virus had a chance to really take a toll on my system. So my oxygen saturation really dropped. So when I put the vagus nerve stimulation on, I did about 2 hours of vagus nerve stimulation, and it finally brought my oxygen saturation back up to about 90 or 91. So it saved me a trip to the hospital. If you have anything that's a systemic inflammatory response, this will stop the production of pro-inflammatory cytokines. So it does help with inflammatory responses in your system. Toxic mold syndrome, tick-borne illnesses, any of those odd viruses that people get from time to time that just kind of show up in your system. It's a good thing to have for that. It works well for anxiety. It works well for depression. It's something that certainly comes into play when we are treating people who've had concussions or brain injuries. Vagus nerve stimulation is a very important part of that. So there are a lot of uses for vagus nerve stimulation. And if you read a little more in the book that comes with your device, you can see a little more of how that works. So that's how you go about doing this. Now, there are some other ways you can apply this. You can take this off and put it on your right ear. If you put it on your right ear, you want to put the Dolphin Neurostim on the plus setting, because the Dolphin Neurostim will tend to stimulate things and bring things up on the plus setting, and the right ear tends to be more stimulating. So if you were really super tired, like when you first got up in the morning, if you wanted to pep your system up a little bit, then you would take and put this on your right ear. The upper conch is a great place. And then you're going to take this and you're going to put it, I recommend people put it about 4 fingers below their belly button and then turn the cycle on. But you should only do it for about 5 minutes. Really much more than that, and it can be a little too much stimulation. Definitely don't do this on positive on your right ear before you go to bed at night. We have had people find that it keeps them up for a few hours, and it's just not, it doesn't make for a restful night. So great first thing in the morning. If you're going to do it later in the afternoon, don't wait till bedtime to do it on the positive setting. On the negative setting is fine. It will calm you down a little bit, but definitely not on the positive setting. So that brings me to the splitter cables. So if you have an older set, you're going to have a smaller splitter, what we call a Y wire. If you have a newer one, you're going to have a longer one like this. Or if you have a much older one, you're not going to have either one of these. So I do recommend that you upgrade to the longer one. It makes this much easier. So what you can do is you can disconnect it from the ear clip and you can plug this in. And now I can actually use 2 ear clips like this. So I could go to both sides of the ear like so. Now, if the left side tends to bring things down more and the right side tends to bring things up more, you can't really choose the negative or positive setting on here. You're going to have to slide it over to the biphasic setting so that the polarity flips back and forth. So if you're going to do this, I do recommend having the white wire go to an electrode on your tummy, not to your right or left wrist. Turn the Dolphin Neurostim on, and then you just let it cycle back and forth. And again, you can do that for up to about 20 or 30 minutes. What we do recommend is that people do an initial 5-minute treatment to see how they react to it. Some people have a very sensitive nervous system. Some people don't. Some people respond very quickly. Some people, it's a much slower thing. So you want to gauge how sensitive your system is, because if you have a very sensitive system, you don't want to go out of the gate and do 30 minutes of vagus nerve stimulation because it'll make you pretty tired. But if you have a lot going on and need the rest, that might be perfectly appropriate. So how do you know how long to do this, under what circumstances? So I'll give you an example. I'm 53 years old. I raised 2 children by myself. I work long days. I start at 8 o'clock in the morning. I finish 6 o'clock at night. I do 10 hours straight through. I don't take a break. I also travel and I teach seminars on how to use this equipment, and I lecture at medical conferences. And, on the weekends, I'm busy doing stuff with my kids. So I'm going all the time. And that was great when I was in my 40s, but I'm in my 50s now, and it's just me. So I need to be able to keep up with everything. And what I find is that if I don't do vagus nerve stimulation, I really start to drag towards the middle of the week, and it just gets worse from there on out. So for me, assuming I'm not sick and I haven't done any kind of intensive workouts, and my workouts generally are pretty light. I'm at a point in my life that I'm not trying to build huge muscle. I just want to keep what I have and, keep my cardio good. So I'm not doing, strongman workouts or anything like that. So I do about 30 minutes of vagus nerve stimulation 2 to 3 times a week. And that's great for me. That works very well for me. Now, if you're an elite athlete, you might do 30 minutes or even an hour of vagus nerve stimulation to push your recovery. If you are extremely ill, you might find yourself doing a couple of hours of vagus nerve stimulation, depending on what your practitioner says you might need to do. So there are different applications for this. What I recommend is if you're trying to figure it out on your own, start with 5 minutes and then add about 5 minutes a day. And when you find what seems to be the right balance for you, then kind of cut it right there. If you aren't quite sure what to do, add 5 minutes a day until you hit somewhere between 20 and 30 minutes, and then do that for a few weeks to gauge where you are with things. And that should get you in a good place. So that's kind of the ins and outs of how to hook up vagus nerve stimulation. Again, if you don't have these dome ear clips, do pick them up in the Black Friday sale. If you do not have the, which is ongoing now, if you don't have this long Y wire, pick that one up as well. Let's see here. So what does vagus nerve stimulation do? Well, it drops your cortisol levels. So it'll drop your cortisol by as much as 50%, and it does that very quickly. That's your stress hormone. It will also alter your high frequency vagal tone, which is a measure of your parasympathetic nervous system. It raises that. So it means that your body is able to heal faster. So it kind of channels your energy into that. And this is all scientifically based off of EKGs and grounded in good science. So this is not some esoteric theory. I mean, we know that it does this from having done studies. So it will also increase your HRV, your heart rate variability. And if you have never looked it up, look up heart rate variability. It's not the same thing as your heart rate. It's the time variance between heartbeats. The higher that number is, the better off you are, the more robust your system is in terms of being able to fight off disease and even keep you from getting injured. There was actually a veterinary study that was done on racehorses some years ago. And what they found was that horses that had low heart rate variability, with all other factors being equal, were much more likely to get injured during track training, and they were actually able to predict which ones wouldn't be able to return from the injuries. So the higher your heart rate variability is, and in this case with the horses, the higher the heart rate variability was, the greater the chance was that the horse would actually be able to return to racing. So that made a big splash in the racing community. So it's a really, really good number. It's one of the things they look at when you have a stress test done at the hospital. If you're going to have surgery of any kind, that's a number that they'll look at. And if it's too low, they might not do surgery on you because it means that your system is already overstressed. And if they put you to sleep, like that might be enough to kill you. So very important number, and you can modulate it with this. This acts as a neuromodulator, and over time you will see changes to those numbers that stick. So this is not just a short-term thing. This actually works to modulate your nervous system and push it where it needs to be. I see a question here that says, does it work for ADHD? Yes, I have attention deficit disorder, and I do use this when I have to sit down and write papers or stuff like that, and it's quite helpful for me. My son has some attention deficit disorder as well, and it is a useful thing for him to do before he has to study for tests. Now, I need to make sure I don't do too much of it because after a full day of school and wrestling practice and whatever else he has going on, he's usually a little tired. So I don't want to do too much of it and conk him out, but it does help him get focused. All right, that should kind of wrap things up for vagus nerve stimulation. When you are doing your treatments, one of the things that you might want, over on the topic of electrodes and stuff like that, there is a cable that looks like, let's see here, where do I have it? There is a cable that looks like this. It is probably not in your kit, but is a recommended thing to have. It has 2 wrist straps on it. So when you're doing treatments with your patients, remember I said you have to have skin-to-skin contact with them? Well, if I put this on and I put this on my patient's wrist, we are connected. So I don't have to worry about touching their skin at that point. We're electrically connected. And so you don't have to worry about, you still have to touch the metal plate on here, but you don't have to get your hands somewhere on their skin. And again, you guys can pick these up on the website. I think they're probably part of the Black Friday sale. They're not expensive. They're about $25. And if you're going to be doing things like getting into treating concussions and stuff like that, this is a good thing to have anyway. So nice accessory to have. And before we go into scars, there is one more thing we need to go over, which is the extension probes. Let me grab one of those for you. There is an extension probe that comes with your device, depending on which kit you bought. It looks like this. It has a metal cup on one end, and just like the one for vagus nerve stimulation, it fits over the end of the unit. And it gives you an extension so that when you're trying to treat yourself, this is bendable. You can bend it any shape you want. You can tape it to a back scratcher and you can use it to treat points in your back. It's useful for that. We have people who use these for treating TMJ, for treating scars inside the mouth and TMJ stuff. When I worked in women's health, we would actually use these for treating episiotomy scars. We would make the patient buy these and take them home and clean them and bring them back. So these are a useful tool to have. Again, pick these up if you don't have any. I would pick up an extra one just so you have it on hand. They're only about $25. So that's another accessory there. So I think that's all their accessories that you guys probably need to know about. So now we need to talk about treating treating scars. So how do we go about doing that? So one of the things we do better than anybody else is treating scars. My background is in neuromuscular therapy and massage. I've had a license in that for about 30 years. I have been to a bazillion courses on scars and the different ways of treating them, scraping them. I've seen injection techniques. I've covered all the bases in terms of scar stuff. And I can tell you that using microcurrent on scars beats everything else hands down, including injection therapy, because with injections, you're trying to repolarize the scar with procaine so it electrically changes the charge of the scar. So when you use the Dolphin Neurostims to treat a scar, you are changing that tissue electrically. Normal body tissue has a negative polarity. Scars have a positive polarity. And if you can flip the charge on there, if you can repolarize that tissue and change it to a negative polarity, an interesting thing happens. And we verified this with diagnostic ultrasound. So what ends up happening is that the density of the scar changes. So if you do a microcurrent treatment properly with the Dolphin Neurostim, you can expect to have about a 20% reduction in the overall density of the scar. And that's permanent. So whatever change you get in that treatment, that sticks. So you could do, so, if you figure about 20% per scar, sometimes it's a lot more. So if you figure like 5 treatments, that should be about 100% release on those scars. So that goes for C-section scars, hysterectomy scars, abdominal surgery scars, mastectomy scars, burn scars, like all those things, about 5 treatments. If it's a huge scar, like a huge burn scar, it's going to take a little bit longer because it's simply more surface area that you have to cover. But it is extremely effective. I could do a treatment today and the tissue will continue to change actually for about 24 to 48 hours after that. So it actually improves over time, and whatever change I get sticks. So I could then go back and do another treatment in a few days, or I could wait 2 weeks or a month. And whatever progress I've gained, the next treatment just moves it forward more. So don't worry about how frequent your treatments are. Just get the treatments in when you can. So how do we go about treating a scar? It's actually quite simple. Now, I do teach a whole 2-day course on scar treatments. There are a lot of cool acupuncture tricks and circuits you can do, and treating internal scarring and treating broken bones. Like there's tons of different things to go over. But for basic scars, if you learn how to do this, this is going to give you a lot of insight into help your patients out, because scars can do a lot of different things. So before we get into how to treat a scar, let's talk about what a scar actually does. Well, scars can be painful. That's one of the number one reasons people get scars treated. They get painful, they get itchy, they burn, they're sensitive to touch. I had a patient the other day who's, gosh, he's like 85 years old, and he couldn't even touch his knee. Like he has all kind of back pain. But what he told me was that what bothers him the most is the fact that he had a knee replacement about 5 years ago, and he just couldn't touch his knee. So he can't kneel down in his garden. It limits all the things he can do. So before I went and treated his back, I treated this scar on his knee, and in one treatment, that scar was completely desensitized. Like he couldn't touch it before, and he can touch it now, and it's fine. So it's a very, very effective, very fast treatment. So when you do this, expect your patients to have a marked reduction in sensitivity of a scar, and also expect the scar to look different too. So they'll actually change color, they'll become more pliable. You'll see scars that are puckered up will relax down. Scars that are dip in will raise up. Scars that are raised up will flatten out. And all that, you can usually see some change in the first treatment. So it's a very, very effective thing. And in addition to sensitivity, scars can pull on things. So a scar can bind things down, especially like knee replacements. They'll go through all the patients will go through all the rehab. And still at the end, there's a few degrees of range of motion they just can't seem to get back. And usually they're told, well, that's just scar tissue. Well, you could do something about that now. You could use microcurrent and change it dramatically. But think about people who've had brain surgeries or any of these kind of scars. It pulls on the connective tissue. So your entire body is covered with a sheet with different sheets of connective tissue called fascia. Okay. And anywhere you put a cut through that, it binds everything down. So it's like it's a body stocking. It gets stuck. So an example of how it can pull would be somebody who has a hip replacement. So they have got a big scar right here. And because of that, it's pulling all through this tissue in here, and they can't raise their arm up. I'm sorry, wrong side. They can't raise their arm up. So you can actually see people who present as having a frozen shoulder who don't really have a frozen shoulder. What they have is a scar somewhere on their body that's pulling on that network of connective tissue that inhibits their range of motion. And if you release that scar, you'll find that their range of motion dramatically increases. So I use that trick quite a bit. When I worked in women's health, I discovered that C-section scars and hysterectomy scars, or really any abdominal surgery scar, is a huge contributor to not only low back, but neck pain. Open heart surgery scars, big time for upper back pain that just won't let go until you treat the scar itself. So the scars can also affect circulation. You'll see people who've had surgery who get a lot of swelling. So in the world of lymphatics, all the lymph in your body has to come up to right here to get cycled back into your system. So anywhere there are cuts through the connective tissue, because lymph moves through kind of potential space between muscle and fascia. And if you make cuts through that and it scars up, the lymph can't get where it needs to and it backs up, and you'll see a lot of swelling in areas. So releasing scars, if you're a lymphatic therapist, releasing scars with microcurrent is a huge thing you can do before you start doing your manual lymphatic drainage. Scars also affect you neurologically. Scars affect the autonomic nervous system. So a scar that is not painful, that is not pulling on anything, that is not messing with your lymphatic flow, can still electrically stimulate the sympathetic nervous system and drive sympathetic arousal. So scars will stimulate the local sympathetic fibers in the body. So your sympathetic nervous system covers more than 90% of your body, and scars hold a higher resting charge in the surrounding tissue. Normal body tissue is about 80 millivolts. Scars can be as high as 1.6 volts. So it's quite a bit more electricity held in there. It's almost like a battery or a capacitor. But anyway, if you can discharge that, repolarize and discharge that, it stops stimulating your nervous system. So what happens when you have a scar that is stimulating your nervous system? Well, it drives up sympathetic arousal. So it actually decreases your heart rate variability. It can raise your cortisol levels. It can make you more on edge. It can keep your adrenals going when they shouldn't be. So it adrenally depletes you. So there are a lot of things that happen. So treating very old scars can often not only make newer injuries less painful, but can also affect things like anxiety. I've seen cases where people had fairly minor plastic surgeries that cut through acupuncture meridians and started having anxiety attacks. And what you'll usually look for is something to manifest anywhere at about the 6-month mark. Anywhere from there on, you'll see anxiety attacks happen. You'll see all kind of interesting things. If you treat the scars, a lot of times that stuff will go away. So those are some of the reasons why you would treat scars. And in the world of acupuncture, a scar that cuts through any of these meridians is considered to block the flow of energy. So if you're an acupuncturist, I would recommend that you do treat any scars on a patient's body before you do your needling, because it's going to affect the flow of chi through the body, and you're not going to get it to go where you need it to go. All right, so let's get into the nuts and bolts of how to treat a scar. So we've got a little whiteboard here. Let me get things positioned so you can see it. And we're going to draw somebody here. We'll draw a little man who is unhappy because he has had open heart surgery. So he's got a really unhappy face here. And there's his arms. There's his trunk right here. Pelvis right here. Legs down here. I'm not an artist of any kind. We're going to give him an open heart surgery scar right here. A nice long scar right there. So what do we need to do to treat the scar? Well, if you're going to do scar treatments, you need 2 Dolphin Neurostims. One is not enough. If you were to try and use a single unit, you're going to have a hard time passing current through the scars because scars are basically non-conductive to electricity. So if you go and use the tip of this and test scars, you generally won't find acupuncture points on there because they don't conduct electricity very well. If you try to put a pad on top of the scar, electricity always takes a path of least resistance. So if it's taking the path of least resistance, it's simply going to go around the scar and it's not going to get into the scar tissue itself. So what you need to do is pass current back and forth across this scar. So you need to take one Dolphin Neurostim and put it on the negative setting. And the other one, you're going to put it on the biphasic setting, the plus minus setting, and you're going to use that. So we're going to use one Dolphin Neurostim on the negative setting over here. Doesn't matter which side. We're going to use the other Dolphin Neurostim on the biphasic setting on the other side like this. And we are going to go on either side of the scar. And we're going to put the units down like this, and we're going to count out 10 beeps. So 1, 2, 3, 4. Once we get to 10, we're going to pick the Dolphin Neurostims up and move them down about 1/4 of an inch. And we're going to do that all the way down the scar till we get the end of the scar. But once we get to the end of the scar, we're going to work our way back up. 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps. And once we've worked our way all the way to the top, we're going to work our way all the way back down again. So that's 10 beeps, 10 beeps, 10 beeps. So once we've done that 3 times at 10 beeps each, that's going to get us to about a total of 30 beeps for the entire scar. So what we've done is we've played ping pong with electrons through this scar tissue. We've bounced, we've forced electrons one way, we've pulled them across, we've picked them up, and we've thrown them back across. So we're literally playing ping pong with electrons back and forth through the scar tissue. So once you've done that 3 times, then you're going to go to either end of the scar. So 10 beeps, and now we're on top of the scar. 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps. And I would do that another 3 times, 10 beeps each. So what we're doing now is once we've passed current back and forth through the scar, we've opened it up a little bit so it's a little more conductive. And now we can put the units directly on top of the scar and force electrons directly into the scar that way. And once you've done that 3 times, so that's another 3 passes at 10 beeps each, you've released your scar. And you should see a significant reduction in the overall how the scar feels and how it looks. And if you were to measure under diagnostic ultrasound, you could look at what's called the cicatrix or cicatrix gray mean density, and you would see a significant change in that. So in practice, this is what it looks like. I've got both Dolphin Neurostims on. I turn them on. I make sure I got an nice green light. Tells me I got a good battery. I have my thumbs on the metal plate. I'm going to put my fingers on the patient's skin somewhere. I'm going to touch down on either side of the scar. I have one unit on negative and one on biphasic. It doesn't really matter. I count out 10 beeps. I work my way down. Now I'm going to do this all the way down the scar 3 times. Then I'm going to go to either end of the scar and start there. Your book may say to actually stay at either end of the scar and plug the ends of the scar. I'm going to recommend that you work your way all the way through like this 3 times. I think you'll see better outcomes that way. So that's a basic scar release. And I cannot begin to tell you how much I love teaching scar treatments and how much I love doing scar treatments because it's a home run every time. It always works. So it's a really nice thing to have in your back pocket. And I do market plastic surgeons because plastic surgeons make scars on people that may look great, but sometimes they're still very sensitive. And the one thing about plastic surgeons is if somebody goes to a plastic surgeon, they've actually paid to have that scar put on them, which means that they have cash they can pay you to desensitize the scar and you don't have to fool with insurance. So it's a nice thing to know. All right. So we have sort of hit the hour mark on here, and we've gone over everything we need to go over except contraindications. So we'll go over those really quick. The Dolphin Neurostim, I like to call this Joe's rules of pencils. Don't stick this thing anywhere you wouldn't stick a pencil. Keep it out of your eyes. Don't jam it way up your nose. Don't stick it deep into your ear. keep it out of places where you wouldn't stick a pencil, and you're pretty good. If you are treating somebody who's pregnant, don't unless the doctor says it's okay, and definitely don't in the first trimester. If you get the okay from the doctor, stay away from points that push energy down, points on top of the shoulders, points on top of the head, hoku, anything around the inside of the ankles. Generally stay away from that. Don't treat over a gravid uterus, just stay away from the tummy. So doctors will prescribe TENS units to patients who are pregnant, and they just tell them, don't put the electrodes on your tummy. So if you can remember that and just treat the back, then you're good. Because usually when you treat pregnant women, you're treating for things like low back pain and sciatica and SI joint problems. So it works well for all those. Treating children is not a problem. I treated both my children when they were babies. We have done workshops for All Children's Hospital in Tampa, and they did use this on babies who had Rhinex, spasmodic torticollis, and it works quite well. Other contraindications. If you have somebody who has a pacemaker or defibrillator, get the doctor's okay first. Do not do it without the doctor's okay. In the case that comes to the Dolphin Neurostim, if you got a black case, this is inside there's a little flap in there. There's a pocket there. So if you open this up, there is a page that has all the electrical parameters of the device on it. You can shoot those over to the doctor's office and they can say yes or no. I'm not a doctor, so I don't do this stuff on patients who have those unless it's okay. Plates, screws, implants, rods, dorsal column spine simulators, insulin pumps, baclofen pumps, bladder stimulators, all those things, those are fine. You can use this on those with no problems. Don't worry about it. Nobody's going to catch on fire. It's not going to do anything to the stimulators, the pumps, all that's fine. Other things, treating cancer. So this is by FDA classifications, a TENS device, and the FDA does caution against using this on people who have active cancer. If you don't have active cancer, it's fine. So if we're going by FDA recommendations, you don't use it on people with cancer. Now, when my family members have had cancer, I use this, but that's me and my choice. But it's not something I recommend to my patients on a regular basis. There are microcurrent devices on the market that do have a medical indication for treating cancer. So the microcurrent is used for reducing brain cancer. So you can draw whatever conclusions you want to from that. I think that hits everything in terms of contraindications. Seizures. Don't treat on top of the head if you happen to have seizures. There are acupuncture points that stop seizures. There's one on the bottom of the foot called kidney 1. It is right here. And that is a great point for stopping seizures. I've actually done it before, and it worked quite well. All right. So with all that out of the way, let's get into the comments here. So let me look and see what questions I have here and answer those for you guys. Does it work for ADHD? Yes, it does work for ADHD. Do you recommend drinking water before treatment? Actually, Gatorade, well, not necessarily Gatorade, but anything with some electrolytes in it, like a little bit of salty water or whatever, does help things out if you have somebody who has connectivity problems. Can you deplete your own energy as you work on patients with a vagus nerve stim, working all day on, say, 6 people, massage therapy wise? No, you're not going to deplete your own energy when you're working on patients with vagus nerve stimulation. If anything, you'll pass a little bit of microcurrent through your system, which will actually tone your sympathetic and parasympathetic nervous system. So it's actually good for you. It's good for your immune system. So I wouldn't worry about that at all. What would you do for internal scars and adhesions? For example, I had a ruptured appendix and had a tube inserted on the left side that went across my abdomen to the left side where my appendix was for about 2 weeks. So I have a lot of adhesions, but no external scar besides a small area on the left. Okay. So you don't see a scar here, but there's definitely scarring inside. So the numbers are this. If you have 1 abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. 2 abdominal surgeries, and this is even if they scope you, it's 100%, absolutely 100%. So how do you deal with that? Well, Even though you don't see any surface scars, we know there are adhesions down in there. So if you take these dolphin neurostims and work across this area, like there's a scar, if I work all the way back and forth this way, and I would work up and down like this. And you're going to get some current passing through those adhesions. And if you want to get really tricky, here's something you can do. You can take the white cable that you got for the vagus nerve stimulation portion of this, and you can put it on one of the dolphin neurostims, okay? You can take the rectangular electrode and you can put that, so let's say you've got abdominal adhesions, you can put that electrode on the back like this. And now, when I do my scar treatments, not only am I treating back and forth this way through the tissue, I'm actually pulling electrons all the way through the system to the back, okay? And then it cycles it through. So that's how you deal with deep abdominal adhesions, or really any deep scarring anywhere. You can just use this little trick, and it does a very nice job of pulling the electrons through that area. So it is quite effective for that. I do a lot of abdominal adhesions, especially when I work in women's health. But even nowadays, because I get patients who have intractable back pain, and nobody has ever treated their abdominal adhesions. And they're going to continue to have pain until somebody treats those scars. And most people don't even know to treat those scars. And even if they know to treat scars, it's really difficult to treat abdominal adhesions. Well, if you're using microcurrent, it's actually really easy. So I do recommend using this as much as you can on those kinds of patients. Let's see what else we got. Can it decrease high blood pressure? There are specific acupuncture points for blood pressure. And if you are doing vagus nerve stimulation and your blood pressure is coming from stress, I would suspect that it would bring that down a little bit. Uh-oh. You guys with me? All right, here we go. Are there treatment protocols for treating wounds? So don't stick these units in an actual wound itself. But if you treat around the wound like a scar, these will increase ATP production by 400 or 500%. In addition to that, it will increase protein synthesis and cellular membrane transport. So I definitely recommend that. Can you guys see me? Because it looks like something happened here. Somebody text on here and let me know. Looks like something happened to the camera here. Let's see what we got here. Frozen picture. Oh, great. All right, hang on a second. Let me stop the video and I'm going to start it over again. All right, there we go. That should be good. All right. If treating a cheek or lip scar, would you use the extension probe intra-orally and other handpiece externally on the skin? All right. So what I've done is switched over to my phone here so you guys can see this. So anyway, let me get back to the chat screen here. All right, let's see here. All right, so does anybody have any questions for me? Because apparently I can't see the old chat. So you guys are gonna have to ask them, just unmute your microphone and ask them that way. So okay, oh, here we go, Mandy Deborah. I see in the book there's a protocol for, all right, let's see what we got here. Sorry about this, guys. All right, I see in the book there's a protocol for cervical spondylosis. Is there one for lumbar? Yeah, you just do the same thing, just go lower, just use the back pain treatment in there. What's the best treatment protocol for ear ringing or fullness in the ear? There actually is a tinnitus protocol. And I have to say that that is one I've had a hard time with over the years. I have a hard time figuring out when it's going to work and when it's not. I'd say it works about half the time. There are a lot of things that can cause tinnitus, so you got to check for trigger points in the neck. You got to make sure there's no head injuries. Scars can pull on things and contribute to that. So if I were doing an ear ringing protocol, I would release all the scars in a patient's body. I would treat the neck, I would treat the back, and I would also do the ear protocol itself. So could you review answer for cheek and lip scar treatment with deep scar into mucosa? Once I can pull the chat up again, I can. With an extension probe intra-orally and other probe on external skin. Yes, you can do that, but don't stick the probe into the if it's recent, don't stick the probe into a recent incision. But yeah, you can certainly treat on the inside. The only problem you're going to run into is this: you only have two hands, so you're going to have your patient hold one Dolphin Neurostim and put their finger on the metal plate and push the button while you put the extension probe in their mouth, and you're going to have to use your other hand to put the Dolphin Neurostim on the outside. So you're going to need your patient's help with that one. All right, what other questions do we have? Is there a way to get a protocol for a concussion if we're not a practitioner without taking a course? So Mandy, have you had a concussion? Can you answer me there? Your kids have. Where do you live? Oh, we got tons of people in Indianapolis. So what I would do is I would contact the main office. So contact the Dolphin Neurostim office and ask them for practitioners in the Indianapolis area. What I would do is I would get them to recommend somebody, and then I would do one visit with a practitioner who does this, so you can watch how they do it. It's a phenomenal thing for concussions, but it's a whole 2-day course to teach how to treat concussions. So it's not really, I can't do a whole lot right here. What I can tell you is that there's an acupuncture point called Heart 9. It's on the pinky finger. It's on the it's near the base of your nail, on kind of on the inside in the skin there. It's very, very sensitive. And it is a really good singular point for concussions. I have changed people's, like I've had kids who had light sensitivity and dizziness and treated that and got some really nice outcomes. That doesn't take the place of the entire protocol, but it is something that can be quite useful for them. All right, muscle activation or vertigo treatments. Yes, we do treat vertigo, and we have certainly used it on patients to activate treatment. Vertigo, again, is one of those things. It's hard to know what it's coming from, so you're going to have to explore different. You're going to have to explore different protocols. One of the points that seems to work well or help a lot in vertigo is gallbladder 41, so GB41, and it's between the pinky toe and the fourth toe. up where the metatarsals come together. So that's a useful point I find in vertigo for a lot of things. All right, what other questions you guys got? Anything? Is everybody good? Everybody have everything you need out of this? All right.
Can
Well,
I
yes.
can I just clarify for the scar treatment, when you go from top to bottom, is that one, or do you have to go top, bottom, top for one?
One is top to bottom.
Okay, perfect. Thank you.
Sure. And the protocol I gave you is like, that's the basic. Like, if you have time to do more than 10 beeps, clearly do 20 beeps or 30 beeps. The more time you spend on that scar, the better off it is. But a lot of people who use this equipment work in physical therapy and occupational therapy clinics. So they have to be able to do things in 15-minute segments because that's how the billing is coded. So we set things up so that you can do a really quick treatment with this. But when I do scar treatments, I'll spend 30 minutes or an hour on my patients. So I can spend an awful lot of time working on somebody, incorporating acupuncture circuits and things like that. So there is certainly a lot more that you can do, but I'm just trying to give you the bare minimum to get outcomes. All right. What else have we got, y'all? Billing codes. Billing codes. So when people code this, they will code 97032, which is attended eSTEM. I've also seen people bill out 97140, which is myofascial release. I've also seen people bill out 97112, which is neuromuscular reeducation. Keep in mind that in each of those cases, your progress notes your notes need to reflect what you've done. So make sure that everything matches up there in case you get audited. Prices, it really varies. There are two ways to do this. You can either figure this as, you can either figure this as being a part of your time that you charge a set rate per hour, or you can say, hey, this is a specialty thing and I charge extra for this. And it's going to depend on where you are in your market. Where I am, if I'm doing scar treatments, I charge $150 for the first treatment. But I do a lot of evaluations. I take pictures of the scar, I measure them. There's a sensitivity test. There's all kind of stuff I do. And then follow-up visits are between $80 and $90, just depending. And those take about half an hour. And then when I'm doing my normal therapy for backs and stuff like that, backs and necks, I just include it as part of my time. In this particular office where I'm working, this is a cash office, so we're not doing billing codes and stuff like that. But I've worked in physiatry offices, I've worked in neurology and neurosurgery offices and women's health. All that was coded, and properly coded, it'll get paid. All right, let's see what else we've got here. Any other things, any other questions? Let me look in the chat. We're kind of running out of time here. It's a protocol for inflammation of the hands and joints. A lot of vagus nerve stimulation. Eliminate all the sugar in your diet and get rid of all the processed wheat. Those are, because if you have inflammation in your hands and joints, you are systemically inflamed. So you need to treat yourself with this, but you also need to treat your entire system. So you need to eliminate all the things that are going into your system that are inflammatory and keep those gone. All right, we are almost at 9 o'clock, guys. So I'll take one more question, and then I have got to go home and take care of my kids. Can you talk a little bit about the certification program we have? We do offer a certification. It requires you to take certain key courses, and you have to do a series of hands-on case studies to send in. I've been through, I went through that myself when we came up with it, and it does take a while to get through it, but it is very useful because not a lot of people are able to stick with it long enough to get through there. So for those of us who have been through it, certainly appreciate it when we see someone else who has taken the time to go through it. All right, guys. Look for an email from us tomorrow, and that will give you your link to watch this again. And also, for Black Friday stuff, I almost forgot to mention this. If you use the code JOEBF 2024, so that's JOE. Let me type it in for you guys. This will help you out with the Black Friday stuff. I promised you that earlier. Let's see here. Joe, I keep typing it wrong. BF, which is Black Friday 2024. That'll help you guys out with the Black Friday sale stuff. So I put it in the chat for you guys. So everybody have a nice evening. You can certainly sign up for this again in the future if you ever want to take this again. It is free, and you guys, who knows, maybe I'll be wearing a different colored shirt, or I might spin it a little bit differently. I've had people come back and listen to this several times. So have a great evening, and thank you so much.